at Apollo Hospitals and welcome to our corporate health series. This is Dr. Srinidhi Chidambaram here. And I hope you're all doing well. In this series, we aim to bring you awareness on health and well-being so that you can enjoy a productive and successful journey ahead. International Women's Day is going to be here. So, as you know, it celebrates the social, economic, cultural, and political achievements of women. But one of the objectives in observing this day is also to assist women to be in a position of power to make informed decisions about their health. So we at Apollo Hospitals have planned a very special week ahead with a marathon of sessions that we have curated so that several aspects of women's health are discussed with our top experts from Apollo Hospitals. When women reach the pinnacle of success and peak productivity, they often forget to look after themselves, to look into factors that may be affecting their well-being and health. One such factor that is often overlooked is bone health. When bones are affected, it can have severe consequences that can affect quality of life. So regardless of age, all women should take steps to protect their bones. You must have heard the term osteoporosis, which is characterized by chronic bone loss that leads to weak bones that fracture easily. Other common bone and joint issues that can occur may be osteoarthritis, degenerative changes in the spine leading to back pain. But with the right steps and effective care, it's possible to boost your bone health and lower your risk of pain and complications. So come, let's learn today about maintaining bone health amidst a hectic work schedule. I am delighted and honored to welcome Dr. Siddhart Yadav to discuss this important topic with us today. Dr. Siddhart Yadav is a renowned orthopedic and joint replacement surgeon at Apollo Hospitals, Mumbai. He brings over 25 years of expertise in treating simple to complex orthopedic conditions. A graduate of NGM Medical College, Indore, he pursued intensive training in hip and knee replacement surgeries across Germany, the USA, and Austria. After specializing in uncemented primary and revision hip replacement and computer-assisted surgeries from Germany, Dr. Yadav further honed his skills at Harvard Medical School, Boston, and the Beth Israel Medical Center, New York. He is proficient in cutting-edge techniques, including primary and revision knee replacement, mobile bearing, high flexion uni knee replacement, cartilage repair surgeries, robotic knee replacement, as well as use of computer-assisted navigation in orthopedic procedures. Recognized for his dedication, Dr. Yadav has earned the prestigious AO International Fellowship and the University Hospital Graz, Austria, for refining techniques in complex fracture surgeries. A proud member of the IOA, WOC, BOS, and ISHKS, he contributes significantly to orthopedic knowledge and delivers commendable results through his 25 years of experience. Dr. Yadav, thank you so much for joining us today in this session, and we look forward to your valuable inputs on bone health for women, especially working women. So let me begin by saying that, as I already said, it is difficult as women grow older. Finding time for work and personal life is a challenge. And one thing that usually gets missed is the bone health, because it's not something that you notice every day. So what can one do in daily life to make sure that our bones stay strong?
Thank you, doctor. Thank you for kind introduction. So very simple things which one can start, even one can start at early age. Number one is physical exercises, because our bones are very active. Unless until we put stress on our bones, we do some activity, they don't get stimulated. When they get stimulated, then the calcium and everything get deposited and bone, they become strong. So exercise is very important. Second thing is nutrition. we should take adequate food which contains calcium. And third is vitamin D. Vitamin D comes from sunlight. So if you have, if in a good place where you can get 10 minutes exposure every day, which is very difficult, then that much exposure of sunlight is important. If you don't, then you have to take vitamin D supplements. So, and healthy lifestyle. We should avoid these bad habits like smoking or too much alcohol. So these are the four things: exercise, nutrition, a good healthy life, where that is essential for your bone health.
So, what are the common conditions that affect bone health, particularly in women?
Women, we should start very early when they are in their teenage, when they start uh, their periods. That time also during the adolescent, they require a lot of vitamin D and calcium, because from there they start building their bone. Up to age of 30, then we accumulate bone. We call peak bone mass. So from there, that is the age we should pay attention to our children. So if they get good peak bone mass, then later on, the chances of weak bone or osteoporosis are less. Because up to 30 years, we gain a lot of, or we deposit a lot of bone. And then what happens after that? The second stage comes to that child when women are pregnant. That time they require a lot of additional calcium and vitamin D. If they are feeding or lactating, again they require a lot of care, vitamin D and calcium. And after that, when they get menopause or perimenopausal age, that time also they require special care. And after menopause, of course, because there is lack of estrogen, we should consult doctor. We should take adequate medication along with good good lifestyle, which I just told you: exercise, nutrition, and good life balance.
So, one thing is that, we did talk about, you've mentioned about what people can do from an early age, starting from time the child attains puberty. But what happens is that, people are now more and more desk bound. So whether it's the teenager who's all the time sitting at the desk or playing with the phone, or whether it is people who are older sitting at desk jobs. So what happens is that there is a prolonged sitting that is inevitable. But we have been hearing that, there are specific things that one can do to make sure that you're moving a lot. So are there any particular tips that you can give on how somebody who's bound to a kind of a desk situation can actually build up this bone health by movement?
Good. So this is common. This can happen with students, those who are studying for long hours, maybe sometime 12 hours or more, and or people in IT job. They sit at least 8 to 10 hours every day on desk. So what happens when they are sitting for long in one position? They get many problems because we are not putting pressure on our bones. So the bone, they get weak. So what we can do certain exercises while sitting. First is we can start like frequent change of posture, like every half an hour, we can get up and again sit. We can also optimize our working station. Like we can buy a laptop stand, which you can sit also, stand also. You can adjust our chair and desk. So it's called ergonomic chair and desk. Now, what all other exercise you can do? For example, you can start, we call it chair squat. Like you are sitting on chair and try to get up and then sit back, but don't sit just before you touch chair, just hold on. Like this is called chair squat that we can do. We can also do, we call it sitting with leg raising. While sitting, you can raise your leg on for 5 to 10 seconds, and that will good for your quadriceps or thigh muscles. Also, we can do stretching our arms and shoulders, also neck stretch, and also ankle. So these are I think there's a certain exercises or this stretching one we can do while working. We can continue work. We can sit down with. We can do our operate, and this kind of, I think, morning at least 3 times, morning, evening, or at least not possible, at least twice. We should do that. These are the exercises we should do, along with frequent break and frequent change of posture.
So I suppose when you're taking calls also, you can walk about instead of sitting and doing it.
Correct. You can do that also. If you are too much on phone, then avoid handpiece. You can have a headphone, or you can talk on a speaker, because because most of the time you are on the keyboard and you hold your phone like this. That gives neck pain. Because if you are doing once in a while like me, it's fine. But you are always on the desk. Your profession is like that. Then you have to, of course, for a long time, you have to make certain strictly you have to follow all these things.
So I think we'd also like to know from you, what happens when you neglect your bone health? What are the consequences?
Well, actually, this osteoporosis, like weakening of bone or bone become porous, we call it silent disease. We won't know unless until something happens. So what happens if you start neglecting your bone? When situation arises, like you are not aware and bones are so weak, all of a sudden you fall and you got some minor fracture, then you realize that's the extreme, like you got osteoporosis. But if you start, like if you neglect for a few hours, you are not exposed to sunlight, your vitamin D is low, your nutrition is low, your activity is low. So first thing you start, like you can get back pains, you can get leg pains, and then gradually on minor fall, you can get fracture. These kind of pain mostly you get end of the day after exertion. And extreme thing is osteoporosis, which is diagnosed by special test called DEXA scan. And then if somebody got osteoporosis, then proper medical treatment is required.
Right. You were talking about nutrition, and we did touch upon it briefly earlier. But as you know, in working life, one, especially women, sometimes don't have the time to pay much attention to their own nutrition, busy packing up lunches for their family, maybe, or there's no time to cook. So, or even at work, there's a lot of ordering from outside. And another phenomenon is that, like there is a lot of also, there is this desire to be slim, and there's also quite a bit of dietary restrictions that we impose on ourselves. For example, not having dairy products, or not having products which may be rich in calcium and vitamin D. So what would your advice be for women to be fit and lean and strong and healthy? And how do they manage, how to do this day in and day out? Since you said nutrition is such a big pillar.
Correct. Nutrition is must, because if you get a lack of energy, then it is not good for your immunity and other issues. So, for example, if this dairy, all the dairy products, they are rich in calcium, but also what we can do, we can have fat-free some of the dairy products. Second thing is we can have some supplements, some food which have additional calcium or vitamin. They call fortified food, which are available everywhere. They are fortified with calcium and D. And third thing is we can have regular vitamin D supplements. So, because you can't have a lot of dairy product, you can get more your cholesterol, more carbohydrate. You can put on weight because of fat, but you can choose it. You take dairy product, but with the fat-free, go for a fortified food, which is enriched with calcium, vitamin D, and you can have nuts also, and you can have additional vitamin D supplements time to time. This is what I advise.
The other thing is about posture. So, does posture affect bone health in any way, and what can we do about it? Because that's another thing which kind of comes into play when you're sitting and working somewhere?
Correct. So, first thing is if you sit for a long time, long hours, then as I told you, you're not putting any pressure or anything on your legs or your spine. You're just sitting. So there is excessive pressure on your back. If you are sitting like bad posture, forward neck bending, doing while operating any PC or keyboard, then there's a pressure on your neck. So then you get a lot of neck pain and back pain. So back pain and neck pain is very common in prolonged sitting. And if you are not doing any exercises, then your core muscles they are weak for your neck and back. That is additional cause of your back and neck pain. And third is due to your nutrition and you are not exposed to sunlight. So vitamin D is deficient. That further reduces. All these leads to your bone. You form less bone in your body, or your bone they become weak. So these are the common causes for. So what I would suggest them to correct your posture, sit properly. As I told early, do the office sitting exercises, frequent change of posture. So we have to make it like routine, part of our lifestyle, day-to-day lifestyle. Then we can continue it for many years.
Coming to menopause, that is a stage which is difficult for many women. And one thing that people may not be aware is that it impacts the bone health as well. So what would you suggest? Is there some kind of a preventive health check or screening that a woman must do when she attains menopause on the bone as well? And we've been hearing about a lot of supplements. Apart from the calcium and vitamin D, there are also other supportive medications that are sometimes given. So what is the role of all that, and what should somebody do when they attain menopause?
So first thing, they should do basic blood test like vitamin D, calcium, phosphorus, parathyroid hormone. These are the basic tests, bone, which are related to bone. Second thing, they can do additional test called DEXA scan. That is to check the actual accurate bone mineral density, we call BMD. So I think this blood test for vitamin D and DEXA scan is very important. And if they are low, then we can start supplementing them and we can correct them. Second part is they should consult their gynecologist if they require hormone replacement therapy. Because in menopause, what happens, the estrogen level comes down and that creates all the problems. So that is, and third thing is, if they are already after DEXA scan, osteoporosis is proven, the bones are, then we can give additional medication, additional to vitamin D and calcium. There are various medicines available depending all these all parameter, age, bone mineral density, amount of vitamin D in body. So then we have to formulate a plan for them for at least for 2-year treatment. And it is reversible. The good thing is it is treatable and reversible.
One also hears that, as one attains menopause, it's more and more important for women to also do strength training so that, they can develop a good muscle mass and preserve their bone density. Would you advise that kind of exercise also, like lifting weights and building up strength?
Absolutely. One should know the very basic, like bones are very, very active tissue. They are not like wood. So if bones are not active, they are not put any pressure, then what happens? The calcium can deposit in the bone, and if they are not very active, it can goes out also. So the calcium deposit in bones when the pressure is put on them. So the exercise is very important. Even if you take vitamin D and calcium, if you are not putting pressure on your bone, we call it weight-bearing exercises before upper being some lifting weight by upper, then the bone mineral density cannot be increased. So any calcium, any vitamin D, any treatment is not effective if you are not doing weight-bearing exercises, like walking for half an hour. That is good for your legs and spine. But for upper limb, for arms, we have to do certain dumbbells, like 1 kg, 2 kg dumbbells exercises you should do. The exercise is very important. Uh, as without that, the treatment is not so effective.
What would you think, supposing person has not been really thinking about their bone health, are there any early warning signs that, at least could kind of help them to, take stock and, at least do something, not.
So early symptoms, so initially what happened, they get start from a pains, like they get back pain, lower back pain, which is very, very common. And that happens after exertion or end of the day. That is first. They also sometimes get long bones pain, like pain in the legs. And these are the early symptoms. But osteoporosis, unfortunately, quantitatively only can be measured by scan, DEXA scan, bone mineral density, because that's the only way. And it's very simple. It is done in every hospital, everywhere. So that is, normally we advise DEXA scan after the age of 40, perimenopausal, after 50, or after 60. So it should be done at least in 1.5 to 2 years. You got to change significant bone mineral density, and if it is, then the interval should be 1.5 years to 2 years, not every 6 months or 3 months. So 1 year is a good time to do the DEXA scan.
So in the DEXA scan, one often notices this term called osteopenia. So what is that, and how does that get treated? What is the difference between that and osteoporosis?
So before, there are 3 stages. One is normal bone, then the bone is little weak, called osteopenia, and bone is very weak, is called osteoporosis. So osteopenia is in between. It is very common, and that it is treatable when you detect. Most of the time, most of us are osteopenic, most of us. So then we give the additional supplement of calcium by diet or oral tablets, vitamin D, and exercise. Osteopenia is not to worry. It can be treatable with simple calcium, vitamin D, and exercise.
I think we have covered most of the aspects of bone health. Any final comments that you would like to say, Doctor?
Yeah, women in our country, they are very sacrificing. They don't take care of themselves. They think about their family and children first, and they neglect a lot. They do not take adequate vitamin D, calcium supplement, even exercise, because they don't get time. So what happened in our country? They get, I would say, at the time of menopause, their physiological age is much more like in Western world, like now because they don't take care of themselves. So my advice is, don't neglect. You are the backbone of our society. Start vitamin D, calcium supplements, exercise, give time to yourself. So later on in life, you will be you'll not face osteoporosis problem. You'll not face any other world problem. So that is my advice. Please do not neglect. Take care of.
Thank you so much, Dr. Yadav. Dear viewers, I do hope that you found this session on bone health useful. Remember, bone health can deteriorate very, very insidiously and you won't even know. Data has shown that 1 in 2 women over the age of 50 can break a bone due to osteoporosis, and the risk remains. So please be aware, do not ignore your bone health, stay strong and live your best life. See you next time. Thank you and namaste.